What is the impact of caffeine, coffee, and tea on concussion recovery? My name is Dr. Paul Hrkal, and this is the question that I'm going to be trying to answer for everybody in this episode today. Let's go. So it's a question I get from our patient population and our members as part of the Concussion Fix program a lot. People are really passionate about their coffee. And as part of the Concussion Fix diet, we do ask members to consider eliminating a few things: refined sugar, alcohol, and we do also talk about coffee and tea, specifically caffeine. However, it's not a hard no. Unlike things like coffee, alcohol, and gluten, we do suggest to totally avoid these 100% of the time. Coffee and tea are a little bit of a gray area, and I want to unpack that because a lot of people interpret their coffee habit as not necessarily a healthy one. So I think innately people know that maybe there's something about drinking 3 or 4 cups of coffee a day that is not the ideal thing. And maybe that's actually making up for the fact that they're tired. But that actually is a separate conversation from actually, are there any detrimental effects or maybe even benefits from consuming coffee or tea? So we should first consider the amount of caffeine in some of the drinks that you might be consuming. Everyone knows that coffee and the various types of coffee like espresso and also even a pour-over coffee, which is here listed first. Well, a lot of people think that because of a stronger taste like you have in an espresso, it's going to have higher caffeine. But actually that's not true. Pour-over coffee has more caffeine in it. And that is substantially more than most average steeped teas. So this is black tea, Camellia sinensis. An 8-ounce cup is going to have roughly 35 to almost 50 milligrams of caffeine in it, which is similar to an espresso, but still less than a pour-over coffee. Green tea has even less in it. But then there's this whole category of other beverages that are found to have non-naturally occurring caffeine, such as energy drinks, soft drinks. Energy shots will have a massive amount, and chocolate, of course. So this just gives you some context of maybe something that you're drinking. Where does that stack up here with the caffeine content? We have to almost think about coffee and caffeine separately. So let's look at coffee just in general when it comes to brain health. And you can see there's a lot of things up here on the screen that are showing that there's a possibly positive benefit. Maybe even heard news stories saying coffee consumption is linked with lower rates of dementia or other health conditions. And so I did a search of the literature, and in fact there is evidence that is correlating the intake of coffee with a reduction in some of the major health categories such as cardiovascular disease, cancer, and neurological dementia and neurocognitive dysfunction conditions. So it seems like on average, the estimated reduction in all-cause mortality, meaning dying of all causes, is about 17%, which is not nothing. That's definitely substantial. But again, despite that, researchers still haven't really done robust interventional studies on this topic, meaning they haven't given people coffee as a treatment for, let's say, some of the health conditions I just mentioned. So I think that there's definitely some possibly potential actions, and there actually is some anti-inflammatory and antioxidant effects from the substances found in coffee. So this is independent of caffeine. I'm talking about the polyphenols, the caffeic acids, the chlorogenic acids, and the other kind of medicinal substances found in coffee. Remember, coffee is a herb, just like tea. On the flip side, then there are some of the not so good things found with coffee consumption. There are some nutrient depletions. We know that 2 cups of coffee approximately depletes about a 1/4 teaspoon of salt from your body. That's again done through its effect on the kidneys. And salt is a very important mineral for regulating your blood pressure and regulating your blood flow and many other functions in the body. Really, a mineral that I would say has gotten a bad rap because of its effect on blood pressure in some people. Not everyone that consume salt is going to have an increase in blood pressure, only the ones that are sensitive to it. But then there's also the medicinal benefits of sodium chloride or salt. So we definitely don't want to deplete it, as is the case in most people. So that can happen after drinking coffee. Also, taurine and B1, vitamin B1, is inhibited with coffee consumption. And you're going to get some potassium, which is another really important mineral for actually regulating cardiovascular function. So we're going to get to the impact on concussions in just a second. And I'm going to kind of go over some of the detrimental effects or potential obstacles with caffeine consumption. So this just gives you an overall summary of coffee. But what about caffeine? We've known caffeine as something that people take when they're tired. It actually isn't a stimulant in its own right, but what it does is that it delays the time until you are feeling sleepy. So it kind of just slows your sleep pressure. And that's actually done by antagonizing something called an adenosine receptor. So this is really helpful when you are fatigued, by increasing your alertness, attention, reaction time, etc. But really only when you're fatigued. If you're well rested, it's not going to really make a big difference. And most people, I think, if they reflect on coffee consumption and getting caffeine there, they'd probably agree that's the case. Now, again, there's some research on caffeine as well, and there's looking at neurodegenerative conditions. And again, just like coffee, it seems like there's some signals of positivity, but we can't definitively say it is going to have a beneficial effect. And there's also some potential benefits on improving the endurance and time to fatigue in sports. So that's been a little bit better researched because it's much easier to control that in a research study, where in neurodegenerative conditions, that's a lot harder because there's so many more variables. So in summary, there's potential, but overall still not definitive and unclear brain boosting effects. Okay, what about caffeine and concussion? So I'm talking about an acute concussion here. The evidence is not that extensive. There's only a few studies, and there really is not any interventional studies, meaning concussed patient given caffeine and then observed and looking at the effect. Especially they haven't compared it to placebo. But there's some things to consider in terms of the mechanism, and this is why some animal model studies, which those studies have been done in the past, have shown that actually might have a detrimental effect, especially right after an injury. And that's because it may actually impact the adenosine receptor. We talked about it is antagonizing that. And the adenosine receptor is really important when it comes to some of the protective mechanisms inside your brain that are trying to be upregulated after sustaining a concussion. It may also impact a really key mineral that is playing a key role inside of your nerve cells, which is calcium. And that really rushes into the nerve cells after a concussion. And so it may impair that. So overall, I would say there's some mixed evidence, but it leans on the side of more possibly having a detrimental effect. So some practical considerations, and I think this is applicable to a lot of people that might be listening to this and actually thinking about they have persistent symptoms. They may not fall into the acute category. So I think the acute we just talked about probably should stay away from it. However, a couple considerations in the more chronic category of long-standing symptoms. So caffeine does stay in your system for about 12 hours at a minimum. It kind of has a half-life of 12 hours, and then it gets broken down by half and then half again. So it actually is even more than 12 hours. And this actually becomes a really important factor if somebody has issues with sleeping, for example. One of the most common symptoms after a concussion is insomnia. Some people sleep more, some people don't sleep well at all. And so caffeine may actually slow the time to be able to get to sleep because, again, it's an effect on the adenosine receptors. And so this might actually impair some of those sleep patterns. This also, I think, is really important if there's any sort of anxiety that's present in people post-injury. This may be present right after a concussion, but it also may be present in chronic persistent symptom cases. So again, I always counsel my patients that if you do have any sort of anxiety, then caffeine should absolutely be avoided. And that's why we kind of talk about it in the Concussion Fix program and say, you know what? If you have a habit of drinking coffee every single day, if you stop it, you are probably going to have some sort of withdrawal headache. Now you can substitute things like tea, which also has caffeine in it, but maybe at a lower amount. And so that will mitigate or decrease the withdrawal effects. And then ultimately you may be able to quote unquote wean off it. Anyone that's ever tried to break their coffee or caffeine habit, do it cold turkey, you're going to get headaches and other withdrawals. So for some people, it's pretty mild, and for some people, it's very, very strong. One other consideration I wanted you to make is that a lot of people have nervous system dysfunction, and also they have dysfunction in their stress resilience system. This is the system called the HPA axis, or the hypothalamus pituitary adrenal axis. And this is the system that kicks in right after a concussion. It's meant to deal with stressors. It's supposed to help you deal with what you're going through. And it has a whole bunch of protective balancing mechanisms that it secretes, like cortisol. Cortisol is our body's stress hormone, and it's an important way that our body regulates our metabolism, regulates energy, and many other functions after any sort of stressful event, including a concussion or the aftermath of a concussion, or even persistent symptoms. Now, if a person is already in a state where their nervous system is hypersensitive, there may or may not be anxiety, they may have autonomic nervous system dysfunction, which is again the imbalance of blood flow and the control, the neurological control of your cardiovascular system, you may have a more sensitive system to caffeine and coffee. So this is, again, another consideration to be careful of. And that is probably why I would say, in summary, the weight of the evidence, in my opinion, is that caffeine should be avoided, both in the form of any type of coffee. And then we're going to talk a little bit here about tea. Tea also contains caffeine. However, it also has a whole bunch of beneficial effects, probably more beneficial effects than coffee itself. And because there are some randomized controlled trials that have been done to look at the impact on psychological symptoms, and unlike coffee, there's a reduction in anxiety, beneficial on cognition, brain function, so changes in the functional imaging. So you can see that there's certain better blood flow in certain areas of the brain after consuming tea. And it's not just one thing that is responsible for that. So we can't just say it's caffeine. It's most likely a combination of all the beneficial substances. And there are some unique ones here that caffeine does not have. So there's these catechins. You could actually go out to the store and buy an extract of green tea, and it may be standardized to something called EGCG for short, epigallocatechin gallate. Fancy word, EGCG is best for summarizing it. And it does have an anti-inflammatory and antioxidant effect. It also helps fuel good bacteria in the gut. And that's one thing, that's why I included the poor bioavailability point here, is because some of it we want to get into the brain, but also it's going to be feeding good bacteria. And there's this gut-brain connection. And that's one of the beneficial effects of some of these plant-based interventions. And then there's also an amino acid called L-theanine. And this is, again, unique to tea. Coffee does not contain L-theanine. And L-theanine itself has a whole bunch of good, beneficial, positive research studies showing it helps improve anxiety, improves insomnia, reduces that nervousness, actually improves focus by promoting alpha brainwaves. It gets into the brain quite easily, unlike the EGCG. And in general, a very, very well-tolerated nutrient. I use it in my clinical practice all the time, and I definitely feel like patients really benefit, especially those that have an anxious and nervous predisposition. There's also a question about dose, and I thought I'd include this here because I just wanted to just put into perspective that for caffeine, it seems like that beneficial effect was around 3 to 4 cups per day in terms of its effect on all-cause mortality. And I think like with caffeine, green tea also seems to have a beneficial effect. And black tea also contains L-theanine, which is one of the medicinal substances found in it. And I've not talked as much about black tea, but there is beneficial effects on black tea because it does have antioxidant benefits itself. So again, 100 to 500 milligrams seems to be the dose of green tea that has beneficial effects. And then finally, matcha tea. Matcha green tea is actually powdered green tea. And so you're actually not just consuming the water that is steeped in tea leaves, or the tea leaves that are steeped in the water, but you're also consuming the tea itself. So that's getting the full plant. And the growth is a little bit different in terms of its shade exposure, and that increases the chlorophyll levels and makes it a little darker and richer, gives you that really bright green color, and also that very unique earthy taste. And then they're stone ground, and then the whole tea and powder is ingested, usually in a very ritualistic way. And there is some caffeine found in matcha green tea, but it seems like because you're ingesting the actual tea leaves themselves, the powder, you're going to get even more of those beneficial catechins, higher levels of antioxidants, up to 10 times more than standard green tea. So I've had members and patients tell me about the beneficial effects of matcha, and they find that it actually has a stimulating kind of like mood boosting effect, a focus effect, very, very notably within, short time after consumption. And it doesn't necessarily have that jittery effect that, 2 cups of coffee that might have, because you're again going to have some of the balancing effects of that L-theanine. A couple practical considerations. I think some of you might have heard this before, but careful of not overheating green tea. You definitely don't want to consume it or steep it in the same level as black tea, which is again over 200 degrees Fahrenheit. And there's some settings on kettles that sometimes can make it a little easier for you to do that. Coffee obviously is steeped in higher levels, temperatures as well without an issue. Milk reduces the bioavailability of those beneficial catechins, but not on the L-theanine. A little bit of acid like lemon juice seems to enhance the bioavailability of those catechins themselves. And then just like coffee with sodium and potassium, B1 and taurine, the substances found in tea, specifically called tannins, they are going to reduce the absorption of things like minerals. So again, calcium is a big one when it comes to decreasing the absorption. You generally don't want to be taking your supplements with coffee and tea because you're not going to get the full beneficial effect, specifically mineral supplements. Now, you should definitely take them at other times because of the depletions, but maybe not the exact same time. And then finally, maybe consider buying organic because both coffee and tea are quite strongly and excessively sprayed. So organic generally will minimize that. And then the tea does absorb the things that are in the ground. So what it's sprayed by and where it's grown does make a difference. Sometimes you don't have a lot of control over that because, for example, most tea comes from India or China or Japan. But the organic, I think, does make a difference. And there's actually quite a bit of evidence showing that this does make a difference in terms of the content of some of these things. Okay, so final takeaways. What do we learn? Tea versus coffee, different medicinal constituents. Both seem to have some research showing that they have beneficial effects on brain health. I probably would lean towards tea as being the winner in terms of its brain beneficial effects. Again, this is talking about non-concussion effects. Now, for people that have persistent symptoms, we always talk about in the Concussion Fix course, it's not about the concussion anymore. The concussion was the trigger of your symptoms. Now you've moved on into persistent concussion symptoms. What are the underlying drivers? And so now we are very interested in maybe increasing the catechin and the caffeic acid and some of the other polyphenols that are present in both tea and coffee. I think on a practical level, if you are a consumer of tea and coffee before your head injury, before your concussion, then most likely you can continue unless you have some aggravations with the caffeine content. Then if you do, especially when it comes to insomnia and anxiety, then maybe consider switching over to a lower dose of caffeine, like let's say going from coffee to tea, or maybe doing some decaffeinated coffee instead of the full caffeinated coffee. So I think that's just a practical front, because there is a withdrawal consideration here. People don't usually get withdrawal symptoms from tea, in my experience, but more so with coffee. Anxiety, insomnia, be careful of symptom triggers. Sometimes this can become worse after sustaining concussion and in the subsequent weeks and months after. People become more sensitive to alcohol for sure, but they also might get more sensitive to caffeine. Your sleep might become more disrupted. So that's another thing to consider as something that you may want to avoid caffeine in general. And that might mean that you have to avoid coffee and tea. And then there might be an amount reason to maybe reduce it. So if you're drinking 4 cups of coffee or you're drinking energy drinks before, that obviously has a whole bunch of other processed ingredients and sugars that we want to avoid. We ask members of the Concussion Fix program to maybe consider reducing sugar intake. Well, how much sugar are you consuming in your coffee? How much in your tea? That should maybe be reduced as well. So these are all partly evidence-based, partly symptom-driven, and then partly just practical personal preference considerations in terms of deciding, should I continue coffee or tea after a concussion? Maybe right after a concussion, I should avoid caffeine because of some of the detrimental effects. And I would probably say more so coffee as a source of caffeine. And then afterwards, using something like maybe green tea to leverage some of the anti-inflammatory benefits could enhance the overall antioxidant intake that you would have if you are tolerant of the caffeine, the small amount of caffeine that's present. So hopefully you found this episode helpful on determining the possible pros and cons to consuming coffee, tea, and caffeine as part of your concussion recovery.